Yeah.
All right. So we also looked at the family context, how siblings are affected, that depression or any of the disorders that are manifest in older siblings may also affect younger siblings, parental relations. So it is a psychopathology in children, we can conclude, is a complex topic. We also looked at temperament. We looked at all of the conditions, temperament. We looked at the environment. We looked at risk increasing experiences like domestic violence, parental divorce. Some of us shared and identified physical abuse, emotional abuse, sexual abuse as the risk increasing experiences which may lead to greater sensitivity and trigger conduct disorders. It may trigger internalizing or externalizing behaviors. We looked at the integrative model, which is Vasey and Dad's integrative model, which talked about the biological, psychological, social, and temperamental processes. These are available and referenced by our study material, and Vasey and Dad's is one such model. There are other models. We also referred to some of the textbooks and the standards like the DSM, ICD, in order to put together these materials. So we talked about manifestation, how it manifests, whether in terms of behavioral problems, emotional problems, and we differentiated between psychopathology and normal behavior. Two of the ways is, one, symptoms frequent intense long lasting So if these symptoms are frequent, intense, and long lasting, and they are causing problems at home, in school, then we can investigate whether these are we are dealing with one or multiple or comorbid psychopathies. We looked at briefly at generalized anxiety disorder. This material will be available to you to go through it. We looked at the developmental course of aggression, aggressive behavior. Now, these numbers are not absolute. As the community of psychologists, as we gain more insight and more research is published, in the 5 years it could be 6 years. It could now DSM has expanded. For example, ADHD DSM-4 ADHD, the observed age of 6 to 7 years, but now they have expanded it to up to even 12 years. So as more research is available, we learn our definitions also might change. But these are consistent with what you need to know from an examination perspective. We looked at the three disruptive behavior disorders, which are oppositional defiant disorder, conduct disorder, and ADHD. ADHD we are going to look at today. This was the main slide for the day. This was the slide which shows the difference between ADHD, ODD, and conduct disorder. ADHD has more to do with impulse control and function and focus. And many times the children, that I am doing something wrong, they may not recognize. They may even feel bad. Many children with ADHD will feel guilty, or they may feel that they are not good enough when they do something wrong. On the other hand, ODD is it is sometimes perceived as rebellion against parents or authority figures or teachers. But conduct disorders are classified when it goes to a level of breaking laws, causing harm, where There is a lack of guilt. There is no responsibility. So these are the broad differences. In terms of individual symptoms, these may vary. We looked at the beginning of ODD, and we went through the case studies. We were beginning to look at conduct disorders. And so we looked at a conduct disorder where it talks about aggression, destruction of property, deceitfulness, lying and stealing, and serious violation of family rules, societal rules, or even school rules, college rules. So these are some of the symptoms of conduct disorder. So conduct disorder can lead to many long-term consequences like school suspension, legal problems, unplanned pregnancy, teenage pregnancies, suicidal ideation, and so on. As we learned earlier and as we saw in some of the other classes, uh, childhood psychopathology is a contributing factor to adult psychopathology. That is, if it is left unresolved, if it is not resolved in the appropriate time, or steps are not taken to help the child, what can happen is that the child can, these behaviors, these disorders can go on into adulthood and sometimes even late adulthood. One example I have observed the case of an 80-plus-year-old man who suffers from late onset psychosis on uh, account of experiences that might have happened much earlier in his life. So today we are going to look at one of the case study of conduct disorder. This is again based on a published paper uh, in the journal Malaysian Family Physician. So the background is there is a 16-year-old girl from rural Malaysia. She lives with both parents and siblings. The father is very authoritarian. Mother has a physical disability. The presenting problems were repeated physical aggression towards parents, smoking and alcohol use, motor racing, reckless driving, truancy, staying out at night, poor school attendance, poor academic performance. And the family context, from the history, they found that the father uses harsh physical punishment for a 16-year-old girl, strict control and boundaries. As we discussed yesterday, sometimes to soften the impact on the child, mother becomes very permissive, a father is overly strict. So as a result, there is an inconsistency between the two parents. Unfortunately, this inconsistency only makes the problem worse. Research tells us that it does not solve or make the problem better. While there may be a short-term gain, there is no long-term gain. In fact, it can exacerbate the any underlying psychopathology. So she was diagnosed with mild conduct disorder. She did not exhibit symptoms of depression, uh, and so the management was parent training, anger management and problem solving, behavioral contracts. In other words, a clear definition of cause and effect, behavior and consequence. If you do X, Y will happen. Many times we want to shield or protect the children, and we don't realize that there is a way to tell them of what is the effect of their behavior in a nice way but honestly. So behavioral contracts say, if you do this, this is what will happen. So rules and consequences. exist, and at the age of 16 our children are growing up very quickly, so they are very aware of the rules and consequences, but in the case of a psychopathology, sometimes our children need to be told in a clinical setting. uh, in this case, the parents and the therapist collaborated with the school and the community support. And within 3 months, there was a significant reduction in aggression and truancy. Both are measurable. And the family communication improved. This case, if you look at it, you can get the statistical details of how much it improved. So this is an example of a case study for the conduct disorder. Today we will look at ADHD. These are some of the, you will recognize some of the symptoms. These are, ADHD is considered one of the most difficult disorders to diagnose because of the overlap with normal behavior, age relevant behaviors, as well as um, with other conditions. So some of you can recognize ADHD in terms of the child is careless, the child is forgetful, even after telling many times. The child cannot sit still, they are extremely restless, they fidget all the time. They are sometimes daydreaming, uh, both in boys and girls, but more prevalent in middle adolescent girls is the tendency to talk too much, excessive talking, disorganization. The room will always be messy permanently. This is not to the normal level, but it will be permanently so, and they struggle to get along with other children. Now, how do you recognize it? So when you recognize ADHD, that we look at the etiology, which is even our textbook as well as DSM and other texts will tell you three things: inattention, inability to pay attention; second, hyperactivity. எப்பொழுதும் அவங்க காஃபி குடிச்ச மாதிரி இருக்கும். Like how if children have drunk too much coffee, that level of hyperactivity. And impulsivity. By impulsivity, what we mean is that yosikama, they will jump into an action without thinking of the consequences. So when we see this, the etiology can be genetic, it can be neonatal exposure to alcohol, cigarettes, drugs, it can be various other causes. This is not only a childhood disorder. There are important gender differences between. In boys, ADHD presents with more externalizing behaviors. There is more aggression, more restlessness. In girls, it presents as inattention, forgetfulness, excessive talking, withdrawing, anxiety. So these are some of the differences between in genders. These are not set in stone. There are boys who will also experience anxiety. They will talk too much, excessive talking. So these are not set in stone, but these are statistically observed to be. There are gender differences between the two genders in ADHD. The prevalence of ADHD in transgender persons is an area of study, but it is not covered under our syllabus for now. So today we will look at ADHD. ADHD is characterized by inappropriate levels of inattention, hyperactivity, and impulsivity. Traditionally, it presents at age 7, 6 or 7, 5, 6, 7, but now DSM, the latest DSM has classified it as up to 12. Now, the main subtypes, there are few types, predominantly inattentive, that is more tending towards internalizing behaviors, predominantly hyperactive impulsive, tending towards externalizing behaviors, and combined. Combined, where it is combined, it is more apparent, but it is also we are given to understand it is more difficult to treat or to address in a clinical setting. Sometimes there are atypical patterns, late onset, and so where children may not show, or it may be masked because they are very high functioning. Sometimes you will see நீங்க பார்த்துருப்பீங்க ஸ்கூல்ல some of the top rankers, top performers, நீங்க கேர்ஃபுல்லா அப்சர்வ் பண்ணி அவங்கள அசஸ் பண்ணா you will find that some of them may be close on that ADHD, on the ADHD scale. They may be high on hyperactivity, high on they may be low on impulsivity, but they will not be able to pay. They get bored with class very easily. So I had an employee like that. So I have seen it in adults as well. So quickly looking at ADHD inattention symptoms. These are most of them are very straightforward. They do not require explanation. Textbook paragraph படிக்காம நீங்க in the slides படிச்சா you will get most of the details and the points to be able to write the long answers. ADHD is a very important from an exam perspective. Almost every other year there has been at least one question for about ADHD, 6 marker or 10 marker. So some of the common inattention symptoms is the lack of attention to detail. If you give the child a task without looking into the details, you say clean up your room, for example, or to do a task in class, it will be done ana ஒரு சின்ன detail or some important detail மறந்துருப்பாங்க. They would have forgotten it. They find it difficult to give sustained attention, and they may not look at you. They may not acknowledge you when you are talking to them. They may be distracted. Many times their work is usually late, or they forget and say, oh, I forgot. They find it difficult to organize themselves. They don't like boring things like homework. They want exciting things like video games, YouTube shorts. Now we are seeing a different aspect where YouTube they don't like long videos. At 10 minutes video na ayo vendave venda. If it's a short which takes 30 seconds, yes, they'll watch it. So one of the I'm a marketer by profession, and in marketing I can tell you that the marketing industry is trying to take advantage of this. So நீங்க பார்த்திருப்பீங்க earlier YouTube videosல நீங்க பார்த்திருப்பீங்க கேர்ஃபுல்லா ஒரு introduction கொடுப்பாங்க, then they will get into the video. Today we want to grab the attention of the children or attention of the viewer within the first 3 seconds. 2 to 3 seconds. The first 2 seconds of the video, we want to grab their attention. So these are things that these are targeted at or they encourage attention deficit, both in children and in adults. So it is important to be aware of this. Children are inattention. The children or adolescent is easily distracted and forgetful. In order to be classified as inattention, at least 6 months these symptoms must be present and cause impairment in social or academic functioning. Many of us may have heard in the term கேட்டிருப்பீங்க academic masking. Academic masking many of the psychological problems of children and adolescents or college students are ignored until their marks start to suffer. That too, board exams, competitive exams, when there is a sudden failure or a sudden slip, then the parents will say, oh, what has happened? Or there is a problem. ஆனா symptoms last 5 years இருந்திருக்கும். ஆனா அந்த symptoms எல்லாம் ignore பண்ணி because of the academic masking, until it manifests as a academic problem or as a problem that is going to cause the child's progress, societal and academic progress to suffer. நாங்க அதை பார்க்கவே மாட்டோம். So that is one of the things that you will address as counselors. So hyperactivity and impulsivity. Hyperactivity is characterized by fidgeting. உட்காரும் போதே they will be fidgeting with the handles of the chair. கால் நடுங்கிட்டே இருக்கும். They will not, it is a they will not be able to sit still. They will want to keep getting up. In Montessori or in early childhood, it may be evidenced by children running around, constantly climbing, constantly wanting to move. They become irritable if they are sitting in a place. So one of the key symptoms is they are often, it looks like the child is driven by a motor. So that is something that these are some of the symptoms of hyperactivity. Impulsivity is they will not let somebody complete a sentence, or they find it very difficult to wait. They find it very difficult to have patience. Again, these should be persistent, developmentally inappropriate or abnormal, and they cause an impairment in the child's functioning. Only then you can classify as impulsivity. நீங்க எந்த குழந்தை பார்த்தாலும் you will see these. So, but that is not inattention, hyperactivity, and impulsivity. As you see more and more children, especially I said it yesterday, I'll say it again, I have great respect for special educators, because they will see these symptoms. நீங்க பார்த்திருப்பீங்க over many years. நீங்க recognize பண்ற nuances from an academic perspective, அதை explain பண்ண முடியாது. It is very fine nuance and very individualized to the child. So I have great respect for those of us who handle children. So now we look at the cognitive mechanism, cognitive and neurological mechanisms. ADHD cases, they will have problems with working memory, sometimes with sensory memory, but more with working memory in retaining and manipulating information. They may have difficulty with voluntary inhibition. If something happens, they must react. Many other children without ADHD may just observe, but these children must react, and they have challenges in sustained attention and their ability to regulate their effort. These are the cognitive side and the neurological side. Functionally, they have careless mistakes, continuous careless mistakes, incomplete work. They are not able to organize themselves even their own room, they cannot organize it. They need continuous help. And they will be seen as the child has so much potential, Anna, without achievement, because they are not able to give sustained attention and follow through. Socially, these children will interrupt. They will, as we mentioned, children will not like to play with them because they will be seen as selfish. In the family, parents will constantly remind how to behave. Parents will have to nag them. They will have to punish them to get even basic things done. So ADHD is not laziness. It is not just hyperactivity. It is there are genuine neurocognitive difficulties which the child or adolescent needs to be taught coping mechanisms and the mechanisms to regulate themselves. It usually takes a long process. I'm sure that many of us here who have dealt with people who have ADHD will be able to share. Now, here we have the case of a 10-year-old child. Again, this is a real case where a 10-year-old girl came in because of academic underperformance and forgetfulness, more than beyond normal. She did not have many overt behavioral problems. She was very quiet, very polite, but she keeps losing her things in school. Out of 10 days in a school, 10 days going to school, 8 days the water bottle will disappear. Desk is always messy, room is always messy. She's not able to pay attention. She forgets teachers' instructions, parents' instructions. On a measured intelligence scale, she is of average intelligence. Anna, she is not able to complete her work. So when they diagnosed, they showed a predominantly inattentive, because there is no externalizing symptoms. These are internalizing behaviors which have occurred. And the intervention and EEG in the Indian context, now EEG is becoming more popular. Anna, parents are very hesitant to allow their children to even get an ADHD diagnosis. Irundhalum, there is a stigma, particularly to do with children and adolescents. In this case, the child received 75 sessions of neurofeedback. Neurofeedback is live with the EEG connected, and various other therapeutic techniques are deployed while the child is on an EEG during these sessions to normalize the child's readings. And so the outcome of this was that post-treatment EEG showed much better theta beta distribution, and the teachers and parents showed better performance and better behavior at home and in school. So the details of this again, in the footnote இருக்கிற paper நீங்க Google பண்ணா, you will get the further details. Now, parenting practices. Many of us are parents, so இத பார்த்த உடனே you and I may be guilty of. I'm also a parent. We will automatically become guilty of some of these behaviors, and some of us may benefit from learning these behaviors. So some of these are in our text, others are taken from other authoritative sources, but some of them are also from clinical practice. So first one, we must always observe the circumstance when a child is paying attention. When a child who has ADHD, there was one case where the child would not listen to anybody until one parent started singing. The parent started singing to the child. Then the child would listen, would only look at the parent, forget everything else around, and focus on the parent's voice. This was one of the ways in which this particular patient could be treated, or could be brought to a place where the patient would be attentive by actually the parent singing. So for various children, the trigger may be different. So it is important to observe when the child is actually paying attention. Secondly, it is important for parents to establish consistent quality bonding time with the child. This is very difficult in the modern context, but it is essential. In some places, we will have parents establish, the mother will establish the time half an hour after school or 1 hour after school to just sit down and talk to the child. The child wants to tell whatever is there in school. Sometimes that may happen at the end of the day, but there should be a consistent quality bonding time. What does this mean? It means the child feels safe and it feels is not pressured and is ready to communicate. It is important that parents will state clear, specific expectations in a calm manner. A parent must set realistic goals. Yeah, yeah. இந்த எக்ஸாம்ல நீ 60 வாங்கின, அடுத்த எக்ஸாம்ல நீ 100 வாங்கணும். To the child, that is an unrealistic goal academically. In terms of behavior also, we must set achievable goals. Because of when the child wins at achievable goals, they begin to broaden both their emotional repertoire and their confidence. Their self-worth also begins to increase. For younger children, it is important to use timeouts rather than corporal punishment, beating, or shouting. Many times when in particularly Indian parents, especially South Indian parents, and the volume control automatica, it will go up. But when the child sees it, when the child sees it, they may perceive it as a loss of control. And so a parent who they think has lost control of the situation, they cannot be comfortable with. So it is important to use timeout, that they have to sit still, they have to be in their room, or they have to be in a place where they are able to calm down from the emotion. Ensure that parents get practical support. Caring for a child with ADHD is exhausting, especially for mothers. It is important to have some form of a support system. Avoid overreacting. I have heard this from psychiatrists, I have heard this from psychologists. It is important when a person has a condition to look at the person as a patient. That helps. That these behaviors are not personal attacks on you. They are not personal. They are not doing it. They are not doing these behaviors in order to target you. They are doing it because that is the condition talking, not the person. Avoid physical punishment and importantly, model the behavior. நாங்க ஒரு குழந்தைக்கு நீ நீ சிட் ஸ்டில் நீ சொல்லிட்டா, நாங்க உட்கார்ந்து ஃபிஜிட் பண்ணிட்டே இருந்தா, that child will perceive the inconsistency. Children observe us very carefully. So what behavior we want to see in them, we need to model that behavior. So this is a case of now we have broadly seen ADHD, ODD, and CD. Now is the time for those of us who are here to make I know it is not a diagnosis, but this is a real case. So we are going to look at it, and some of you can tell us or share with us what you believe it is. So the background. Vikram is a 14-year-old student from an urban middle-class family in Chennai. He was brought to a clinic by the father, who says he is bringing shame to the family. In school, what are the observations? He frequently skips school. He is found loitering in the mall during class hours. Recently, he was caught hiding the failed report card under the mattress to avoid showing his parents. Then last week, he was suspended, where he injured a classmate using a metal scale or a metal ruler. Teachers report that he hums loudly to disturb the class, but he's hyper-focused on mobile games. So these are the observation in school. Observation at home. he stole his mother's ring to buy Robux. Robux is a in-game game currency for Roblox, the game Roblox. So when he was confronted, he looked at his father in the eye and lied, even though there was evidence or proof. Cruelty. His neighbors saw him trap a stray cat and inside a box and kick it. Animal cruelty. And he laughed when he was scolded for this. He refuses to follow any household rules and he blames other people for his mistakes. So the mic is yours, or you can type it in chat. Based on these symptoms, does Vikram have ADHD, ODD, or conduct disorder? And why do you say? Whatever the answer, why? Please justify why you say he has ADD, or ADHD, ODD, or conduct disorder.
It looks like he's got a conduct disorder, right?
Why do you say that?
Absent to the school, then and trapping a stray cat. So he's not sympathetic person.
Okay.
So he laughed, and so all this looks like it's a conduct disorder, because ADHD can be controlled, because they cannot be true. They are not truants. And ODD also, it can be a little control. Only the conduct disorder children have these kind of symptoms.
Okay. So any other answers?
I
Anyone
go
else
with
has?
combination. I
Other
go
wing
with combination of all.
Okay.
It's a combination.
Why would you say that?
Because it is including of they have a habit of they stealing one, and they are not paying attention. That itself comes under ADHD.
Okay.
And refusing. So all three are in the same the activity.
Okay.
So
Excellent.
he is not able to realize, or what to say, and வருத்தப்படுறது அது
Correct.
they're
Remorse.
telling that remorse. Yeah,
Remorse. வருத்தப்படுறது.
he is
Yes.
not able to realize. So
Okay.
I would go with the combination.
You would go with a combination. Okay. Any other perspectives?
So it's comorbid also.
So are you saying it is ODD and conduct disorder comorbidity?
It can be that, but mostly I feel it's like a conduct disorder.
Okay.
Because stealing and not being sympathetic towards animals and all that, and not attending the school mostly, and there is not regretting for so all this looks like a conduct disorder.
Right. So let us look at it. So the correct diagnosis in this case. So this is a known case. This is one of the cases that both master's level students as well as psychiatry students study. This also is available online. It is the final diagnosis was conduct disorder, correctly, with possible comorbidity of ADHD and ODD, because of but leaning towards conduct disorder. This was justified, as you correctly mentioned, Carolyn ma'am, by the callousness, cruelty towards animals. Not this now ODD symptoms are he blaming somebody else for your failures, but cruelty and violence. There is also the observation from school where the injured a classmate with a metal ruler. Now these point predominantly to progression to conduct disorder. So this was a case of conduct disorder with comorbidity of ADD, of ADHD and ODD, but primarily conduct disorder. So this is based on a very broad criteria, but in a clinical setting, நாங்க கேஸ் நோட்ஸை பார்த்து ஸ்பெசிஃபிக்ஸை பார்த்து observations, ஃபார் எக்ஸாம்பிள் observations இங்கே 3 பாயிண்ட் போட்டிருக்கேன். ஆனால் in a real world setting, it will be a lengthy notes which covers relationships, what is the circumstance, how are the teachers, what is the school environment. In the background, நமக்கு தெரியும். In the clinical setting. So it is very important for us to look at it from a clinical setting. But you all are correct. It is conduct disorder with a comorbidity of the other two conditions as well. Well done. So we come to the treatment and prevention. So treatment and prevention of disruptive behavioral disorders, which are primarily externalizing, not completely externalizing, but primarily externalizing, is parent training, parent skills training, teaching parents how to be consistent, teaching parents how to be calm. In an Indian context, as counselors, this has a very vast scope because we have many cultures, many languages, our behavioral variations between various states, various regions, leave a lot open. We are able to, we will be even able to see soon region-specific or culture-specific parent skills training that many people offer to help parents be consistent, give positive discipline, and reinforcement. So many times as parents, we become auditors. We are fault finders. That you have done this wrong, you have done this wrong. So if you count one of the exercises of mindfulness, if we count in a day to your child, if you don't have children, to your colleagues, to your friends, how many positive or reinforcing statements do you make compared to the number of negative statements that we make? It is a good practice to note down, to count how many out of our mouth, what kind of statements are coming. Of course, child-focused therapies and adolescent-focused therapies, there is behavioral therapy, emotional regulation training, teaching them problem-solving skills, social skills. In the school, there are in the classroom behavior plans. Japan la paatha, this is a very advanced science where they employ psychology in many things. Classroom behavior plans, now for example, you will see that even lining up, there is a method to do it. And the methodல ஒரு benefit இருக்கும். Those things are articulated very beautifully and very clearly to children from a young age onwards. Safety practices. It teaches empathy. So classroom behavior plans will clearly show in the activity செய்யும்போது அதோடைய expectations, associated expectations என்ன, அதானக்கப்புறம் what could go wrong, what is the அதோடைய failure point என்ன, and the failure point, the failure, if the failure occurs, அதோடைய consequence என்ன. These things are articulated clearly in a classroom behavior. நீங்க materials, for example pencil and eraser, what are the consequences, what happens. See, these are articulated very clearly. So, and of course, collaboration between teachers, parents, and clinicians. This is happening more and more in schools, where schools are employing counselors to help children. Not only in it is coming to all mainstream schools, um, and today we may say no, it is useless. Many people like to think like that. But once it becomes systemic, we will begin to see the benefit of the child, for the children and for parents. For the treatment for ODD and conduct disorders, there is no consistent evidence that medications can treat. But medications are useful for comorbid ADHD and ADHD comorbid conditions. It is useful. So stimulants, we can see stimulant use for ADHD and antidepressants for mood or anxiety disorders. Very important aspect that we must stress is early identification of at-risk children. Oh, our nature அப்படி இருக்கு, or academics, he is doing fine in school. அப்படி சொல்லி we kind of ignore, we don't pay attention to family stress levels, early aggression, occasional violence, bullying, the child's temperament, the child's tendencies. These become more difficult to observe in adolescence. For example, many children will want their own room. In behind closed doors, என்ன நடக்குதோ யாருக்கும் தெரியாது. So it is important for, as both counselors and as parents and as uncles, aunts, friends, to observe, to be able to observe and identify at-risk children. Parenting support and early childhood programs. These are very important to help parents, equip parents with the tools, equip teachers with the tools to help children emotionally self-regulate. Now, we will quickly look at the examination from the examination perspective. These were some of the questions. Discuss in detail about childhood behavioral problems. Write an overview of child psychopathology. There are 10-mark questions. ADHD, twice it has come, June 2024 and May 2021. Child psychopathology also has come twice. Internalizing and externalizing problems. The textbook, explicit textbook, they have not given it in detail, but it is one of the questions within the curriculum. 6 marks, again, elaborate on identifying psychopathology. Behavior modification, it will be more for from another chapter, and also from the counseling psychology perspective. Temperament and personality, idu rendu, it is there in our chapter. Please go through that. Behavior checklist is more to do with diagnosis and assessment, which will be in the next chapter. 2 marks is usually these definitions. You will get basic, what is ADHD, what is temperament, what is child psychopathology. So these are some of the questions that we will come across. So we will conclude today's session with chapter 6. Chapter 7 we will do at a later time. If you have any questions, any comments, any observations with children that you have seen or children you have worked with, please share. As colleagues, we would all love to hear your perspective.
Hi, sir.
Still, excuse me, sir.
Yes, madam.
Many of the movie based on the true stories, they are mostly based on the child behaviors, isn't it, sir?
நீங்க சொன்னது correct, madam. Many of the movies, in fact, psychology, many of the movies even consult counselors and psychologists to gather data from, for example, I will give you one example which caused a big issue. But it was not recent. So there is a doctor I know. In the 1970s, 1971, ஒரு movie வந்திருந்தது. It is called, in Kannada it is a Kannada movie called Sharapanjara. It is a very landmark movie of that time. It is a tragedy movie. It is about how society treats a woman with postpartum psychosis. It was a very powerful movie. And in fact, once one doctor who I was talking to was saying, when they were in the hospital, a lady had come with postpartum psychosis. She was hallucinating. She had memory. There was severe memory loss, suffering much trauma, and the doctor made a mistake of referring to her as a Sharapanjara case. That became a big issue here in Karnataka, in Bangalore. In Mangalore, it became a big issue because many of the movies use, in fact, they even consult psychologists and psychiatrists to understand how certain behaviors, especially with children and adolescents, how they happen. Naveen,
For example, Psycho and the Ratchasan movies also.
yes, absolutely.
Hi, sir. I know a kid, my colleagues, maybe he is around 7 years. He is brilliant in studies. So,
Yeah.
memorizing the names, even he knows all the birds' names. He excellently answers everything he does. The problem is he is not able to sit in a place for a second. That is one thing, and he has an habit of hurting others when he is disturbed. Like he just run away from the classes outside in between the class. He never minds asking permission or something like that. He runs away, and until and unless if we don't disturb him or give instructions like being sit there, go there, he'll get too much of uncontrollable tension, and he used to bite. So these are the challenges for the child, but otherwise is good at he eats well, he sleeps well, he wakes up, he's intelligent. So do you really think that at the early stage that we need that counseling?
We cannot comment based on the limited history. நாங்க அவ்வளோ ஈஸியா காமெண்ட் பண்ண முடியாது. பட் it is always worth it to get an assessment done in the school. Parents கிட்ட சொன்னா parents ரொம்ப offense எடுத்துக்குவாங்க. Say, are you saying my child is mad? Straight that response we will get, and then it will affect your relationship also. So in many cases, school assessment பண்றது, குழந்தை ஸ்கூல் கவுன்சிலர் இருந்தாங்கன்னா, or if they have a psychologist there, அவங்க நார்மல் as part of the school curriculum, சில ஸ்கூல்ஸ்ல they will do assessment. They will do an assessment. Ana assessment they will not tell the parents or tell the child. They will have a conversation with the child, observe the behaviors of the child. There are ethical issues that we must be careful. It is not easy, especially in the Indian environment. It is not easy to the diagnosis of psychopathology is very difficult, especially with children. So very carefully, the parents must observe the behavior, and in many cases we have noticed that even with children who are diagnosed ADHD, we have noticed that their symptoms reduce when their activity level increases. As their activity level increases, as they are made They are made to run. They are made. There is a physical outlet for their, especially if it's a boy, a physical outlet for their for the aggression or any of the externalizing behaviors. It helps them. Even for adults with ADHD. And that's why they say exercise is one of the best medicines for ADHD.
Okay, sir. Thank you.
As Alan said, no, they take it very offensive. We are not in a because in a very conservative society we are in. So parents take it very offensive when we say that your child has a disorder. So and they don't know what is ADHD also. So it's very difficult. When I went to the school also, I whatever the Alan said, the symptoms almost they have this ADHD symptoms. Some of the children. So I hope they will be all right. But I think even the school has to concentrate and give them some kind of training for some difficult children whenever they're facing some not a conduct disorder is not that much, but definitely there is ADHD in few children. Conduct disorder maybe one in a class or two in a class. It do exist. Alan, is your sixth lesson over?
Yes, sixth lesson is over. We have covered the syllabus as well as extra information from the counseling perspective.
But you could have continued with the seventh also. Seventh is how big? Smaller?
No, seventh, the detail we have to go into some of the tests. We have to go into some of the assessments because psychological assessment for children, the assessment tools, we will have to go into Wechsler scales. We will have to go into the explanation of how Wechsler works, children's memory scale, working memory rating scale, behavioral checklists. That will come. So that is actually a more detailed chapter. So that might require one full session. So so what we can do is we can do it at the end. I would advise doing it at the end. Covering it in short will not, even from the question paper perspective,
we are coming to an end. We almost done actually. Correct. Yours is and mine is remaining.
Right.
So yeah. So can you do it tomorrow? Complete it tomorrow?
Tomorrow might be a challenge. I can complete it on another day. Tomorrow maybe I have another engagement, but I can complete it on any other day. I will coordinate with you offline.
Okay, fine. Okay, you can stop recording.
Yes.
Yeah.
All right. Thank you everyone for
thank you
participating and for being part of it. Good night.
Good night, everyone.
Thank you all.